And as the state strategizes how it will eventually start phase one of reopening our economy, public health experts are calling for widespread testing and contact tracing. Governor Edwards has set a goal of 200,000 tests per month, and state health officials say they'll need about 700 contact tracers, too. Now, those tracers would interview COVID-infected people and then track down anyone they had come into contact with when they were contagious. Those people could then be isolated. This is done to make sure that people do not transmit the disease without knowing it. About 40% of people who are giving COVID to others have no symptoms. Elective medical procedures considered to be time-sensitive resumed today in Louisiana, but who really meets that criteria? Charisse Gibson spoke to a healthcare professional and joins us live from her home tonight. Hi, Charisse.
How you doing, Karen? Well, those medical procedures, of course, were stopped at the beginning of the COVID-19 outbreak. And of course, that was to free up some medical resources. And this was also done to make sure that the spread would not continue in hospitals. But again, today, Governor Edwards did mention that the Louisiana Department of Health is allowing those elective procedures to move forward, but this is on a case-by-case basis. So when we talk about case-by-case basis, what medical procedures are being considered here? Well, you have to think of it like this. Someone who is in extreme pain and all of that pain is detrimental to their health or leaving them in dire health, those would be considered. But for those who have procedures that are elective and could wait, that could possibly be put on hold.
Cosmetic procedure, could be something that they certainly want to have happen, and they might make them feel better afterwards, and it would maybe relieve some anxiety that they might have or doubts that they might have. And so we want them to have that opportunity to get their needs dealt with. But that may or may not need to be done right now. And someone is presenting with severe, worst in their lifetime abdominal pain, and they may have an active case of appendicitis. And waiting, if you have an active case of appendicitis, simply puts you at a higher risk that you're going to be very ill, that your appendix could rupture. And that's not what we want for anybody. So if someone has
Well, according to the Louisiana Dental Association, they can move forward with procedures in the dentist's office as well. I know a lot of people have sent us questions about that. They posted this list on their website talking about what procedures and what visits can move forward, and they count those teeth cleanings as preventative visits and sensitive to time as well. So, of course, those could move forward, as well as bring your child to the dentist as well. So give your dentist a call so you can figure out when you can reschedule that procedure. Karen.
Are there precautions we should take before and after these visits, though?
Yes, Karen, there are some precautions that you definitely want to take before and after these visits. According to Dr. Springate, he mentioned that people, which we should already be social distancing, should think about social distancing measures, being socially distant 2 weeks before and 2 weeks after your procedure. He says that a lot of these hospitals are already taking preventative measures to make sure that COVID-19 doesn't spread within the hospital. But the same thing is for the Louisiana Dental Association. Both mentioned that if they find someone happens to have any symptoms of COVID-19, maybe a fever, any body aches, they will push that person, or recommend rather that person test for COVID-19. And if they do test positive for COVID-19, they will possibly push that surgery or that elective procedure back even further. Karen.
All right, Charisse, thanks very much. Good to see you again, too.